How to diagnose glaucoma in seconds. Currently, we are diagnosing glaucoma based on the cupping paradigm, which was mistakenly introduced in the 1850s, over 170 years ago. At that time, ophthalmologists with the newly invented ophthalmoscope observed the appearance of the optic disc in chronic glaucoma subjects as being cupped. This observation gave birth to a wrong cupping paradigm, which has possibly misdirected glaucoma research for well over a century and a half. The orderly peripheral-to-central loss of nerve fibers. The most distinctive and hallmark feature of glaucoma is the orderly peripheral-to-central loss of nerve fibers. This is the reason perimetry is performed in glaucoma. If the visual field loss were unpredictable and occurring randomly, then the role of perimetry in glaucoma would be of no value. The orderly peripheral central loss of the visual field can be seen in the schematic diagram. In the early stages of glaucoma, we see isolated scotomas being produced within the 10 to 20 degrees pericentral area, followed by these isolated scotomas coalescing to form a double ring arcuate scotoma, along with simultaneous peripheral field constriction. The peripheral field constriction then joins with the ring scotoma, and only the central vision remains due to the abundance of macular fibers. At the end stage of glaucoma, the central vision is also lost, resulting in total blindness. The orderly peripheral central loss of nerve fibers occurring in glaucoma cannot be explained by cupping for two main reasons. First, if cupping of the optic disc was taking place, then the central vision should be lost first. However, the exact opposite field loss is occurring. The peripheral fields are being lost at the early stages, and the central fields are being lost at the end stage of glaucoma. Second, it is inconceivable that elevated intraocular pressure, by its direct action, would selectively destroy the retinal nerve fibers in such an orderly sequence. The puzzling question then arises: how is elevated IOP, being the established cause of glaucoma, leading to the orderly loss of nerve fibers? The answer is that only a mechanical process can achieve the orderly loss of nerve fibers. Another question then arises: then how is elevated IOP leading to this mechanical process? The answer may lie in that elevated IOP must be destroying an important component of the optic disc first, thereby creating a mechanical process for the orderly loss of nerve fibers. Elevated IOP may be degenerating the border tissue of Elschnig, resulting in sinking of the lamina cribrosa. This border tissue lies between the sclera and the lamina cribrosa and holds the lamina cribrosa firmly in place like an O-ring seal. Sinking of the lamina cribrosa will lead to stretching and the orderly severance or exotomy of nerve fibers at the scleral edge. As you can see in the schematic diagram, the lamina cribrosa is sinking and the peripheralmost nerve fibers are being severed first at the scleral edge, shown here as layer 5. It will then follow an orderly process through layer 4, 3, 2, and 1. The original cups are fibrous remnants of Burgmeister's papilla and have no relevance to glaucoma. While evaluating an optic disc for glaucoma, we can disregard the size of these original cups and keep only two things in mind. First, that the lamina cribrosa is sinking in its entirety. If there is no sinking of the lamina cribrosa, then most likely no glaucoma. Second, due to sinking of the lamina cribrosa, the nerve fibers, along with the vasculature, are being stretched and severed in an orderly peripheral essential sequence at the scleral edge. How to diagnose glaucoma in seconds. As can be seen in the top photo, in the early glaucomatous disc, there will be temporal pallor due to severance of the microvasculature, while no change in size of the original cup. A prominent scleral edge can also be seen due to thinning of the retinal nerve fiber layer, resulting from the exotomy of nerve fibers at the scleral edge. There would also be sloping of the blood vessels at the disc margin due to sinking of the lamina cribrosa. As glaucoma progresses, as can be seen on the bottom photo, the sloping of the blood vessels will turn into kinking due to the progressive sinking of the lamina cribrosa, and disc excavation will be produced by the exotomy of nerve fibers. Please subscribe to my channel if you'd like to see some more content. Thank you.